have learned a tremendous amount recently about how the brain controls eye movements. So the way we're using the eye tracking platform in Ondri is a way to just assess brain health. And when there's abnormalities in how the patients control their eye movements, we get insight into what's wrong in the brain. So what we're hoping to find with these is we measure an individual's how they move their eyes around performing different tasks or watching video. And what we're looking for are early changes that are different from what normal people do. And then we plan to follow those changes over time in Ondri to see how that's related to the progression of the disease. And we're specifically looking for early biomarkers, we call them, abnormalities in the control of eye movements that we can then track in time with the patients to see if the patients are getting worse or if there's any treatments that come along to see if the patients are actually getting better.
So when a subject comes in, it's very much like an optometrist's exam. And in front of them is a screen and a special camera that illuminates their face and tracks where their eyes are looking. We have a couple different tasks that we run. They're designed to run from all ages from 5 till 90. So the first task, they get an instruction dot, and if the dot was green, then they look at the next dot that appears, and it'll appear on the left or the right. And if the middle dot was red, then they will look away from that dot. It's very structured, so their eyes are going to move to specific spots on the screen in a specific pattern. And from that, we can assess exactly how they move their eyes, how fast they move their eyes, how well they can remember the instructions that they were given, and the pattern you move your eyes in, the trajectory they take, how fast they are, how many mistakes you make. And so after a short break, they perform a second task. And what they're going to see on the screen this time is movie clips. And it's almost like someone was changing the channel on a TV that you were looking at. And so you get short clips for a few seconds each. When a new video comes on, the first couple eye movements they make are involuntary. And so we're interested in what the brain finds interesting in those first couple eye movements.
And we're going to get new insight into brain function and what's wrong with patients with these diseases that we've never had before. And so we're going to make novel insights into these diseases and ultimately how we might help treat them in the future.